Hello, Professor Noller. So I would say that this week's podcast challenged me, I would say emotionally. They were talking about the special enrollment period for the Affordable Care Act for insurance. And I got me thinking about, a lot of people losing their jobs because of COVID, their businesses shut down. And then they lose their jobs and they get sick and they can't afford their insurance and they don't have insurance coverage anymore. And for, people doing that, it has to be very scary to think like, I lost my work. What if I get sick? What if my children get sick? How are we going to pay for our insurance? And that really shouldn't be something people need to worry about right now with everything that's going on. They should just be worrying about staying healthy and staying safe. So that was pretty emotional. They also talked about Medicaid and making it easier, which I think is a good thing, especially for what we're going through right now, and how Trump, he added work requirements, but that's hard for people right now who aren't working in COVID, and so Biden ridding those and extending Medicaid. I think that that's a really good thing to happen, especially with the current climate that we're in. They also talked about vaccine hesitancy, which has been a recurring topic that I've noticed. They were saying that 60 to 80% of people in nursing homes in a few states were refusing the vaccine. And for someone who's in public health, someone who wants the vaccine, it's really frustrating and kind of sad to hear that there's still this level of mistrust this far into the process. And it really, is disheartening to think like, well, if this doesn't change, we're never going to have herd immunity and we're never going to be able to go back to, things that we took for granted before last March even, So it's a little frustrating to think about that. And then, a few topics that raised my concern or just caught my attention, again, with the vaccine hesitancy, they were saying that to gain herd immunity, Biden might address this, or is Biden going to address this on the national and community level? And it really caught my attention when they started talking about people who and trust, getting these outreach programs to talk to people who people trust to, kind of go to the people and not make the people go to the vaccine. So that was something that really caught my attention. Also, the Mexico City policy caught my attention. Biden is bringing it back. I think that policy does a lot of good things for, abortion rights, AIDS, and HIV protection. And they were talking about how it's going to be a good issue with Democrats and Republicans. And it just does get a little frustrating because I don't think of it from a political side, which I know there is a political side. I think of it from a person side. Like, if I was a person who was suffering from one of those things, I don't want it to be some big governmental issue. I just want help. I don't want, to worry about the red tape and everything that's going on in the politics. And, I just want to know that I can get help somewhere. So that kind of caught my attention. Another thing that caught my attention is when they talked about new vaccines that could possibly be rolling out. Like they mentioned Johnson & Johnson, a few other companies, which would make it more accessible and there'd be a faster rollout because there'd be different options out there for people to get vaccines. This podcast today really did not conflict with any beliefs that I have. It was pretty straightforward. Everything I said, I either agreed with or, had questions about, so I didn't fully understand it. Some of my questions were, they talked a lot about confirming Senate and House seats and committees. I don't know a lot about that, so that whole segment was a little confusing to me. Another thing that's confusing to me, and I know it's pretty controversial, is the Trump impeachment. I don't really understand it from a standpoint of he's out of office, the Democrats are in, we can do good things. Stop spending money and resources on impeaching someone who's out of office. I know there's probably more to it, but I just think we're in a pandemic right now. That shouldn't be taking precedent. Helping people, getting vaccines out, doing more of a media campaign for vaccines, If we still have this amount of vaccine hesitancy, why are we so worried about impeaching someone who's not in office? It seems like it's getting a little old, however many times they've tried to impeach him. Just Biden's president, let's be happy with that and do what we can right now and stop worrying about things that are in the past. And then they were also talking about budget reconciliation. I don't know a lot about that, so I was a little confused when they were talking about how we're still in the fiscal year and that was a little confusing to me. So I'm probably going to research that just because I don't know a lot about budget reconciliation for our government. And then, so the ideas meshed with some of my experiences and other courses, talking about the vaccine and how Biden's going to aim to get another 200 million. In classes, we've been talking a lot about, vaccine rollout, vaccine hesitancy. Something I thought was very interesting is how they mentioned, broadening the spans of who they reach out to through like Instagram and TikTok. And I can relate because I have both of those apps on my phone. Someone who is frequent on those apps, seeing something for vaccines or, just other people getting vaccines, I feel like that would definitely reach a lot more people than they think it would. And so I think that maybe in a media campaign that would be something good. Get a famous TikToker or someone who has a big following on Instagram. And I think that would really access young people who can then explain it and help older people, because they also talked about how the websites are, you have to wait. It takes an hour to make an appointment. And some people either don't have that time or just can't figure it out. And one woman was talking about how she was helping her mom, and if she wasn't there, her mom wouldn't have gotten the appointment. And so I think if you reach the younger generation, they can really help the older generation, because I know that I have grandparents, and if I were to sit down and help them, they'd probably have a better chance of getting the vaccine than if they were out and trying to do it on their own, not going through their doctor. So I think that that's a really important thing that maybe needs to be looked at a little closer is, if you can reach kids or, teenagers, or in my, situation, young 20s, those people can really help the older people who might be having trouble. And I think that's really important, and that might be being a little overlooked because there is no media campaign right now for the vaccination. So that's just kind of one of my ideas for that. But this podcast was really interesting this week. I'm looking forward to researching, about the budget reconciliation and the confirming of the Senate and House committees and seats.